So good morning everyone. My name is Margaret Sumukad. I'm from BSN 2A7 and I'm here to do the male catheterization. So let's get started. So the first one we need to do is we need to check the doctor's order or verify the order first. So let's check the doctor's order first before doing the procedure. Okay, perfect. Here. So after verifying the order of the doctors, we need to ensure the privacy of the patient for doing this procedure. So we need to close all the curtains in the side of the bed of the patient. So after that, we need to prepare all the materials. And here are the materials for the catheterization procedures here in the bedside of the patient. So after that, we need to identify the patient of any allergies he have. So, hi sir, my name is Margaret Sumukat. I am your nurse for today and I'm here to do the catheterization. So, may I ask you sir, if you have any allergies of food or seafood or any allergies do you have? So you don't have any allergies. So perfect. So let me identify you. So what is your name? Your Miguel Sumukat. Date of birth? Okay. Okay, so thank you, sir. Perfect. So after identifying any allergies and identifying the name of the patient, we need to perform hand hygiene first. So I have here alcohol. And after performing hand hygiene or putting alcohol in our hands, we need to put the patients in comfortable position or flexing her knees upward to ready to perform the catheterization. So, sir, I see you. So, please up. Okay. So after that, we need to position the patient in lithotomy position to ready for the procedure. So here, he is ready for the procedure. So after that, we need to perform hand hygiene. So I have here alcohol and after putting alcohol in our hands, we need to prepare the catheter for the procedure. So after preparing the materials near to the patient, we need to put the sterile gloves in our hands. So let's put it. Here to put the sterile gloves in my hands. So for putting sterile gloves in our hands, we must be very careful for putting the sterile gloves in our hands. So this won't be contaminated. Another one. So we are done putting the sterile gloves in our hands. So the plastic, let's put this away. Thank you. So after putting sterile gloves in our hands, we need to put the sterile pads in the patient's buttocks. So this is an improvisation of the sterile pads. We assume that this is a sterile pads. So may I ask you, sir, to raise your butt a little bit, and I I insert these pads into your buttocks. So, good. Good. And after that, we need to prepare the antiseptic solution for cleaning the meatus of the patients. So I have here the alcohol swab, 3 alcohol swab. So after preparing the alcohol swab for cleaning the meatus, we need to insert the 10 cc of syringe to the catheter port. So let's insert this catheter. Insert this syringe. Have 10 cc. So this is a 10 cc syringe with water. So we need to insert this to the port of the catheter. So this is the catheter and the Eurobag. I insert it advance. So let's assume that we insert the water or the 10 cc catheter to the port of the catheter. Okay. I insert the water. Remember, do not inflate and pull it back, the syringe, and so we are done inserting the 10 cc water to the catheter port. So we are ready to clean the meatus and insert the catheter to the urethra of the patient. After attaching the 10 cc syringe with water to the port of the catheter, we need to lubricate it. So we assume that this is an lubrication for the catheter. So we need to put lubrication before inserting the catheter to the urethra. So done. We proceed to the next procedure. So after attaching and lubricating the catheter of the patient, we need to perform the hygiene for the meatus of the patient. So I have here alcohol swab, 3 alcohol swab. So we assume that this is in alcohol swab. So I have here my dominant, non-dominant hand. I put this into the meatus of the patient and clean the rest. So put this, and the first alcohol swab, 1 circle only. Okay. 1. Exaggerate and put another alcohol swab. Another alcohol swab here, and on the other side, 1 only circle. 1, exaggerate, put away, and the last one, alcohol swab, 1 only, exaggerate. So we are ready to insert the catheter to the urethra because the meatus is clean now. So we are ready to insert the catheter into the urethra of the patient. So may I ask you to exhale and exhale, sir, so that we can insert the catheter slowly and safely. So are you ready to insert the catheter, sir? So exhale. So I insert the catheter. Inhale. That good. Good. I see some urine. So we need to go down to 2 cm so that it can be perfect. Okay, so I see the urine in the urobag. We put the urobag into the side of the bedside of the patient. So here. And I have here improvisation of a stabilizer. So we need to assume that this is a stabilizer. So we need to put this on the legs of the patient here. And perfect, sir. You are done. So we are done inserting the catheter in the urethra of the patient. So we are done inserting the catheter in the urethra of the patient. So we need to dispose all the materials that are used in this procedure. So we're putting this away. The materials used here. This away. And remove the sterile gloves in our hands. After disposing all the materials and after removing the gloves in our hands, we need to perform hand hygiene after the procedure and before the procedure. So I have here alcohol, or we should wash our hands in a water and a soap also. So after performing hand hygiene or putting the alcohol in our hands, we need to position the patients in comfortable position. So, sir, we are done. I am here too. So you can put your legs down and need to relax. Okay. So after putting the patient into comfortable position, we need to document all the procedure that we are performing, all we need to document all. So that's the last. So we are done, and